Good morning. I am Rima, tutor at M College of Nursing, Department of Mental Health Nursing. In this video, I will be discussing about various behavior therapy techniques which you will be able to use for your patient either to increase adaptive behavior or to decrease maladaptive behavior and to teach new behavior. Let us now see the definition of behavior therapy. It is a form of treatment for problems in which a trained person deliberately establishes a professional relationship with the objectives of removing or modifying existing symptoms and promoting positive personality growth and development. The other definition, that is a form of psychotherapy, the goal of which is to modify maladaptive behavior patterns by reinforcing more of the adaptive behavior. Both of the definition, it is clear that behavior therapy mainly focuses on teaching the patient to have adaptive behavior and prevent maladaptive behavior. The various behavioral techniques are systematic desensitization, flooding, aversion therapy, positive reinforcement, token economy, modeling, shaping, chaining, extinction, otherwise called as ignoring, punishment, timeout, restitution, response cost, assertiveness, and social skill training. We'll be seeing each one. First one is systematic desensitization. This technique was first developed by Joseph Wall and it's based on the principle of counter conditioning. In this technique, the patient is first made to attain a state of complete relaxation, and then the patient is exposed to the stimulus that produces anxiety response. And then this negative reaction of anxiety is reduced by the relaxed state, and the process is called as reciprocal inhibition. It consists of three main steps: relaxation, training, hierarchy construction, and desensitization of stimuli. Relaxation training. There are various methods which can be used on patient to induce relaxation. Some of them are Jacobson's progressive muscle relaxation, hypnosis, meditation or yoga, mental imagery, and biofeedback. Hierarchy construction. In this step, the patient is asked to list down all the situation or conditions which provokes anxiety. And then the patient is asked to list down all this item in a descending order of anxiety provocation. Desensitization of a stimulus. This step can be done either in reality or through imagination. At first, the lowest item in the hierarchy is confronted. The patient is advised to signal whenever anxiety is produced. With each signal, the patient is asked to relax. After a few trials, the patient will be able to control his anxiety gradually. Indication of systematic desensitization are phobias, obsession, compulsion, and certain sexual disorders. Flooding. This is a technique where the patient is directly exposed to the phobic stimulus and escape is made impossible. But through prolonged contact with the phobic stimulus, along with the therapist's guidance, support, and encouragement, the patient will be able to reduce his anxiety. Indication is specific phobias. Aversion therapy. This technique involves pairing of the pleasant stimulus with an unpleasant stimulus so that even in the absence of unpleasant response, the pleasant stimulus become unpleasant by association. It's a form of punishment, and this should be administered immediately after a specific maladaptive behavior. Some of the example of unpleasant responses which are used are electrical stimulus, drugs, social disapproval, or even fantasy. A classic example of aversion therapy is disulfiram therapy, which is administered for an alcoholic patient. When the patient is during this therapy, even the smell of alcohol, or if the patient consumes a small amount of alcohol, it creates a serious reaction in his body. Therefore, the patient tends to reduce his habit of alcohol consumption. Indication of aversion therapies are alcohol abuse, paraphilias, homosexuality, and transvestism. Now, let us see behavioral techniques to improve adaptive behavior. First one is positive reinforcement. In this technique, a reward is provided to the patient following the occurrence of an adaptive behavior. These rewards can be in the form of food, gifts, or praise. An example of simple praise words are like saying, great job, good work, excellent, keep it up. This technique helps to strengthen the adaptive behavior of the patient, and there is a likelihood that there will be the behavior can frequently occur. The technique is used to increase desired behavior. Token economy. This technique involves giving a token reward for an appropriate or desired behavior which is performed by the patient. The token can later be then exchanged for other reward. For an example, on an inpatient hospital ward, if the patient have received a certain amount of rewards or token, these tokens can be used to purchase luxury items or certain privileges. Behavioral techniques to teach new behavior. Modeling. This technique is best to teach behaviors among children. This technique involves teaching by demonstration. For example, a child learns his activities, conversation, and behavior by observing his parents. Likewise, in this technique, the therapist acts as a model where the patient observes the conversation, actions, and behavior of the therapist and imitate them. Shaping is a technique which involves teaching a particular skills or a behavior step by step. Here, the therapy starts shaping or reinforcing the existing behavior, and once this behavior is being reinforced, the therapist will now reinforce the behavior which is close to the desired behavior. For an example, in order to teach social behavior, such as to establish eye contact, the therapist sits opposite the patient and reinforces him even if the patient moves his upper body towards him. And once this is established, the therapist will now reinforce the person's head movement in his direction. And this procedure continues until eye contact is established. Chaining. Chaining is a technique which is used to teach a person or to perform a complex task where the complex task is broken down into a smaller steps and each steps is taught to the patient. It can be forward chaining or backward chaining. In forward chaining, teaching is done with the first step goes on to the second step and then to the third and so on. In backward chaining, one teaching starts with the last step and goes on to the next step in a backward fashion. Backward chaining is used mainly to teach or train a mentally retarded person. Now let us see behavior techniques to decrease maladaptive behavior. First one is extinction, which is otherwise called as ignoring. It means removal of attention or reward from the patient following a problem behavior. This action includes like not looking at the patient, not talking to the patient, or having no physical contact with the patient following the problem behavior. Punishment. This is a type of aversive stimulus. Again, this should be presented to the patient or the person following undesirable behavior. And a clear explanation should be given to the person as to why the patient is receiving the punishment. Timeout. This involves removing the patient from the reward or the reward from the patient for a particular period of time following a problem behavior. This technique is used in the treatment of childhood disorders. For example, the child is not allowed to go out of the ward to play if he fails to complete the given work or task. Restitution, otherwise called as overcorrection, it means restoring the disturbed situation to a state that is much better than it was before the occurrence of the problem behavior. For example, if the patient passes urine in the ward, he would be required to not only clean the dirty area but also mop the entire larger area of the floor in the ward. Response cost. This technique is used on those individual or a person who are already on token economy program for teaching adaptive behavior. So in this technique, whenever undesirable behavior occurs, a fixed number of tokens or points which was received by the patient earlier will be deducted. Assertive skill training is a type of behavior therapy technique in which the patient is given training about changing his emotion and behavior by being assertive. Here, the client is encouraged not to be afraid of showing an appropriate response, whether it is negative or positive, to an idea or suggestion. Assertive training is mainly given by role play, and then the patient is made to practice in real life situation. In this technique, attention mainly given in order to improve his interpersonal skills. Social skill training. This is done mainly to improve his social manners, like encouraging the patient to maintain or establish eye contact, speaking appropriately, relating to people, and to observe simple daily etiquettes. Now, let us see the role of a nurse in administering behavioral therapy. First and foremost, it is important for the nurse to recognize the patient's problem, and this can be done through a proper assessment and history collection. Then is to identify appropriate techniques required for patient. This is to choose the right therapy for the patients in order to manage the problematic behavior. It is also important for the nurse to provide support and encouragement whenever the patient exhibits adaptive behavior. This will encourage the patient to repeat those adaptive behavior. Follow the principles of psychiatric nursing. This is very important, especially accepting the patient exactly as he is, irrespective of what the problem the patient is having, and being non judgmental. And also, it is important for you as a nurse to allow the patient to express his feelings. And these steps will help you as a nurse to understand and have clarity on the patient, and it helps in implementation of your nursing care. So in this video, we have discussed about various behavioral techniques that improves adaptive behavior, decreases maladaptive behavior, and behavior techniques that helps in teaching new behaviors. Thank you.